The assessment that I researched for management of scars was the POSAS, Patient and Observer Scar Assessment Scale. The Patient and Observer Scar Assessment Scale is considered to be one of the most reliable scar assessment scales. This was developed originally in 2004 and modified in 2005 with a subjective assessment of the effects of scarring on daily life, which is very important to take into consideration when thinking about the occupational therapy perspective of treating scars. There is now a third edition that will be launched later this year. The Patient and Observer Scar Assessment Scale includes two perspectives, one from the clinician and one from the patient themselves. Both of these perspectives are considered to be observational assessments, with the patient portion being a self-assessment. For the observer portion, there are categories of vascularization, pigmentation, thickness, relief, and pliability. Within the category of pigmentation, it includes options of hypo, which is when there is a low amount of melanin produced in skin and the impacted area appears to be lighter than the normal skin color, a mix, and hyperpigmentation, which is when there is an excess amount of melanin produced and the skin appears to be darker. For the patient portion, there are questions about pain, itching, color, stiffness, thickness, and irregularity. For both the observer portion and the patient portion, the rankings are on a scale from 1 to 10, with 1 being normal skin and 10 being the worst scar imaginable. When determining who this assessment targets, it's important to remember that age range is not applicable because this assessment can be used on anyone of any age who is experiencing a scar. The scars that can be included within this assessment are immature scars, which tend to appear as pink in color, hard to the touch, raised off the initial skin, and itchy for the individual, usually taking around 1 to 2 years to mature and reverse these symptoms. Keloid scars, which are scars that appear after an injury heals and tend to be raised off the skin. Linear scars, which are the largest category of surgical scars, and burn scars. Here is the scoring sheet for both the observer portion and the patient portion of the Patient and Observer Scar Assessment Scale. For the observer portion, you can see the 5 categories with the subcategories for pigmentation, and you can see the scale of 1 to 10, with 1 meaning normal skin and 10 meaning the worst scar imaginable. There is also a section where this total score can be determined, which would range from 5 to a 50, depending on the severity of the individual's scar. For the patient portion, you can see that there are 2 different categories, with one category having 2 questions and the other category having 4 questions. For the 2 questions, the scale of 1 to 10 ranges from a 1 being no complaints, and a 10 being yes, worst imaginable. For the second portion, you can see that a 1 means no, as in normal skin, and 10 as in yes, very different. There is also a section for the total score to be determined for the patient portion, which would range on a scale of 6 to 60, depending on the severity of the individual's scar. On this next slide, I've included the definitions for the 5 categories of the observer portion of the Patient and Observer Scar Assessment Scale. It's important to note that for both vascularity and pigmentation portions, there is a slide glass that is used. The slide glass is applied for blanching to determine the amount of blood that returns for vascularity, and for pigmentation, there is moderate pressure applied to determine the coloring and pigmentation of the skin. Up next, we will be looking at the overview of administration and scoring of the Patient and Observer Scar Assessment Scale. First up is the observer portion. There are 5 different categories, which were determined in the last slide with their definitions, and these 5 categories can be ranked on a scale of 1 to 10, with 1 indicating normal skin and 10 indicating worst scar imaginable. It's also important to note that for vascularization and pigmentation, a slide glass is used to determine the best possible outcome for the score. The observer scale scores can range from 5 to 50. If someone were to score a 5, this would mean that each of the 5 categories they scored a 1. Meaning that they have normal skin. However, if they were to receive a 50 as their total score, this would indicate that they gave a 10 for each of the 5 categories, determining that they have the worst scar imaginable. Up second is the patient portion. There are 6 different questions that the patient is asked to fill out in regards to their scar. All 6 questions are rated on a scale of 1 to 10, similar to the observer portion. However, there are 2 different categories. For the first category, this includes the questions, is the scar painful? And is the scar itching? And a 1 for this section would mean that the patient says no, no complaints, and a 10 would indicate yes, worst scar imaginable. For the last 4 questions, including is the color of the scar different, is the scar more stiff, is the thickness of the scar different, and is the scar irregular, a 1 would mean no, as in normal skin, and a 10 would indicate yes, very different. For the patient portion, the scale scores can range from a 6 to a 60. If someone were to score a 6, this would mean that they scored all 6 questions as a 1, meaning that they felt no, no complaints, and no as in normal skin. However, if someone were to score a 60, then they would determine that yes, worst imaginable, and yes, very different. For the administration of this assessment, I was not able to administer on an individual, so I gave 3 pictures of scars and decided to provide the observer portion to the best of my ability, based on the pictures. However, I left out the pliability category because the pliability category looks at how well a scar is able to fold, and we are not able to see this through the pictures. It is also important to remember that for vascularization and pigmentation, normally this would be determined for best scoring with a slide glass. However, since I'm just looking at the pictures, I did the best that I could to determine what the score would have been with the slide glass. For example 1, we have a scar on the hand. I rated vascularization at a score of 7 because for coloring, this is in between a red and a purple. For pigmentation, I rated a score of an 8 because the skin is clearly hyperpigmented, meaning that the scar portion is darker than the regular portion of skin. For thickness, I rated this scar as a 6 because we can tell in the picture that the scar is raised off of the normal skin level. And for relief, I scored a 9. For example 2, I scored vascularization at a 4 because the color is in between a pink and a red. For pigmentation, I scored a 5 because I determined that this is a mix of hyper and hypopigmentation, meaning that there's portions of the scar that look like they are lighter than the normal skin color, and there are also portions that look darker. For thickness, I determined the score of 2 because we can tell that the scar is slightly raised off the normal skin level, but nothing extremely noticeable. And for relief, I scored a 2. For example 3, for vascularization, I scored a 2 because this normal skin color is almost pale. It is almost back to normal. For pigmentation, I left the score of 2 because the skin is not completely healed yet and the surrounding area is a bit hyperpigmented, meaning that it is darker than the normal surrounding skin color. For thickness, I scored a 1 because we can tell from this picture that the skin on the scar is at the same level as the surrounding skin. And for relief, I scored a 4. Up next, we will be looking at psychometrics. I looked at 2 different articles for psychometrics, the first being a study from 2005. This study determined that the patient and observer scar assessment scale is quite reliable, as the internal consistency of the observer portion came out to be 0.86 and of the patient portion came out to be 0.90. The reliability for total score for 3 observers was 0.96 with P as less than 0.001. The reliability for the separate items for 3 observers for R was greater than 0.86 and P was less than 0.001. Intra-observer reliability for the total score was 0.94 with P being less than 0.001. Intra-observer reliability for separate items, R was greater than 0.89 and P was less than 0.001. For the single observer total score, R was equal to 0.88 and P was less than 0.001. For single observer separate items, R was greater than 0.70 and P was less than 0.001. The observer scale coefficient of variation was equal to 10.4% and the patient scale coefficient of variation was equal to 15.8%. The second article that I looked at for psychometrics was a study from 2016. This study focused on the reliability of the Vancouver SCAR scale versus the reliability of the patient and observer SCAR assessment scale. Although both of these scales are very reliable, it was determined through this that both portions of the patient and observer SCAR assessment scale are slightly more reliable than the Vancouver SCAR scale. In this slide, I also provided information about the intra-observer reliability of the Vancouver SCAR scale and of the observer component of the patient and observer SCAR assessment scale through the total scores, as well as the correlation between observer scores using the Vancouver SCAR scale and the observer component of the patient and Observer Scar Assessment Scale, as well as the patient scores using the Patient and Observer Scar Assessment Scale total scores. Lastly, we will be analyzing potential biases surrounding the Patient and Observer Scar Assessment Scale. There was not a lot of information about this. However, one article provided me with some insights, as well as stating that there needs to be further follow-ups determining whether or not there are item bias. However, neither preliminary analysis nor critical review spotted any major potential sources of item biases in the Patient and Observer Scar Assessment Scale. However, it is important to recognize that there could be bias surrounding intrinsic differences in the physical appearance of scars. This could possibly be due to the scar area of a burn scar being larger on average than the scar area of a linear scar. In addition, the matching criterion and differences in item difficulty could also be a potential bias, as this criterion may not be applicable to every single scar, and therefore it may be difficult to rate and compare scars that do not fall under all of the categories. On my own, I also determined a few additional bias factors, which could include the individuals getting to score themselves. Individuals may want to appear that their scar is having less of an impact on them than it truly is, and therefore they may not be completely honest about the severity of their scar or about their pain level. Here I have provided some discussion questions, which will also be posted in my link on the Moodle. First up, we have what type of OT interventions could be used with a client following their completion of the Patient and Observer Scar Assessment Scale. Next, we have what about this assessment is unique to other scar assessments, and what kind of impact could this have on their treatment outcomes? Lastly, we have when and where would be an appropriate time to provide this assessment. Could it be repeated once before treatment begins and then given periodically throughout to see if any improvement was made? And here are the references that I used for this project. Thank you so much for watching.